All right, cool. Good morning, everyone. My name is Zach Sarkis. I'm here with New York HempLab. We are happy to be presenting part 2 of the New York State hemp extract bill workshop. And today we have Jason Klimek of Boyle & Code, and he's also a board member of New York HempLab, and Joe Vitale of Cassitter Cannabis Group, who is the head guy behind the rules and regulations. So we got a unique group that's here to offer perspective. We created this program because we want to be giving more insight into what the proposed regs are, how they're going to impact our businesses, what this means for you, and what this means for the industry moving forward. So thank you to everyone who is in attendance right now. Please feel free to drop questions either in the chat or in the Q&A box. We will be very responsive throughout the entirety of this event. And yeah, for all those who registered who couldn't be here today, we're happy to be sharing this recording with you as well. So today we are looking at part 2, which will be pages 24 through I think 44. And we're calling this section licenses and requirements. So we start at section 1005.7, which looks at requirements for cannabinoid hemp processors. Next section, 0.8 is requirements, product requirements to be sold at retail. 0.9 looks at packaging and labeling requirements. 0.10 looks at lab testing requirements. 0.11 looks at requirements for hemp retailers. And 0.12 looks at advertising. So the point of this is we're going to go line by line. We're going to provide feedback from our professional perspectives. And again, everyone in the crowd, feel free to drop questions as we move forward. If you have any questions in advance, like right now, you already got a burning question that you think we might cover today, please, feel free to drop that into the chat as well. Jason, Joe, you guys got anything else you'd like to add this morning? Okay, great. Cool. So I'm going to share my screen here. And all right, looks like I got it to work. The scrolling feature, just because I'm doing full screen, might not be enabled, but we'll start here. So last time we kind of alternated between readers, and again, each line or each paragraph, if there's something important that sticks out to us as individuals, we'll address. And again, if people have questions out there, just drop a line. All right, so section 1005.7, requirements for cannabinoid hemp processors. A, all cannabinoid hemp processors shall, 1, extract hemp extract and or manufacture cannabinoid hemp products to GMP standards and maintain a qualified third-party certification to the satisfaction of the department for the applicable GMP standards for the duration of that license. 2 is maintain standard operating procedures and quality control standards to ensure consistency of hemp extract and or cannabinoid hemp products, including but not limited to product purity, strength, and composition. Let's see here. Okay, just got it there? Okay, there's 1, there's 2. Okay, great. Number 3, maintain sufficient records to demonstrate that any hemp or hemp extract used by the licensee was grown, derived, extracted, and transported in accordance with applicable laws and licensing requirements of the jurisdictions from which the hemp or hemp extract was sourced. Such records shall include any pesticides used in the growing of such hemp, dates each shipment was received, adequate chain of custody to demonstrate from whom the licensee purchased such hemp or hemp extract, and certificates of analysis. For hemp received from an out-of-state grower, processor shall also maintain records of the out-of-state grower registration or license number of the respective jurisdiction.
Zach, I thought this one was particularly interesting because it puts a requirement that you either have to know that they were compliant with another state's or potentially country's laws. And because these are probably some of the most restrictive regs in the country, not only do they have to meet those, but then the product also has to meet New York's. And so you get into a big contracting issue because, what happens if you are contracting with an out-of-state grower and they say, yeah, no, we're in compliance. And then New York State figures out somehow that they're not. And New York State comes after you because they don't have jurisdiction to go after the out-of-state person. That person never came into New York. They only can go after you. So if you don't have a good contract that says you weren't and you covenant that this is all in compliance and that you're going to indemnify me, which they may not want to sign, you could be left holding the bag and in trouble with New York, and you could be paying fines or whatever that is because the other person did something wrong and you tried to do your due diligence. So that's a very important paragraph that really, I say it as a lawyer, but like it's important. Hire a lawyer, get a good contract. These contracts are not something that, should be 2 pages long. And I hate the excuse of, oh, well, we don't like complicated things. Life is complicated. Like it just is. And when you simplify things, you get left holding the bag. So like very important thing to know that you're responsible for an out-of-state grower's compliance.
Yeah. Yeah, it's great feedback. And like looking at it, I don't know what the processing requirements for the previous bill were, but yeah, looking at, it's interesting about the language around jurisdictions. Obviously, this is federal, then there's state, but is there county, is there municipal jurisdictions, and how far back is the government, is our regulatory body going to go and analyze? So again, from your chain of custody, your proof of integrity through the supply chain, it seems like there's a lot of opportunity to kind of run into some trouble there. And it's interesting, like, shall include any pesticides used in growing such hemp. I think that's an interesting one. I wonder if this isn't one of those like open-ended that says like such records shall include pesticides, but not limited to pesticides. So I'm wondering if they'll expand on what they're going to be required to report. And is it, when we go back from like state to state requirement, like what if New Hampshire doesn't require you to report what pesticides you use, or they have you submit it in an email form versus having a formal document. So think about going through your chain of custody and making sure everything is in a format that you could hand to the state that is clear. It seems like, yeah, it's kind of stepping things up. So there's a question already. We came in from Tom. What do you guys mean compliant hemp? There are holes everywhere. My compliant test last year were 0.31%, but within the 0.099% margin of error and allowed by ag markets. Small grower, didn't harvest for 2 weeks during the last 2-day window. Absolutely hot, but 100% compliant. So right now we're looking at under these regulations, we're talking about total Delta 9, which we mentioned last workshop that it was out of alignment with the federal total THC of 0.3. So this is, I would underline and highlight that hole that you mentioned there, Tom, is like we have almost like a standalone New York State bill that is almost innately in contradiction with the federal requirements. And I think that's something that we all have to be aware of.
I would say almost because you're out of alignment enough where you could trip a federal law, you almost have to look at this as kind of like recreational cannabis. This is kind of New York State's thing. And if you're in 100% compliance with New York law or regs, you may not be in compliance with feds, which means you may potentially get in trouble if you sell something out of state. If you're looking at just that Delta 9, well, USDA and feds have said, well, it's total THC. And there's a variance that if you go to like 0.4%, you're like negligent, but they're not going to, incarcerate you. They're just going to make you destroy your product. So, it is very important to make sure you know what invisible lines you're crossing.
And I think too, further, like we're talking about processors and where processors are sourcing from. And if a processor wants to source something that was hot, as you said it, that came from New Hampshire or out of state, like that's federally illegal. But if it's within state, there is leeway because of the way we're defining hot hemp or legal hemp in New York State. So you as a farmer may be protected and in turn be able to still maintain a relationship with New York State processors where you couldn't send your product out of state because of crossing federal, the state lines, which is federal offense. So I think that's important to note. All right. Number 4, keep all designated extracting and manufacturing areas safe and sanitary, including but not limited to ensuring that such areas are adequately lit, clean, smoke-free, and no food is consumed in such areas. I'm sure that's just standard when it comes to GMP certification. 5, provide all employees performing extraction or manufacturing with adequate training and proper safety equipment. 6, manufacture cannabinoid hemp products in accordance with section 1005.8 of this part. Test a statistically significant number of cannabinoid hemp products per lot or batch at a third-party testing laboratory meeting all the requirements of section 1005.10 of this part, and maintain a certificate analysis for all samples tested.
Who remembers what statistically significant means? You know, you got to step back to math. Like that's like, and it depends. It could be 1%, 3%, 5% of your batch, because, you know, if you test one thing out of 1,000 samples, that's probably not statistically significant. It's not. But the regs aren't exactly telling us what is. Is it, you know, if you have 1,000 products, is it testing 50 of them? Is it testing 30? Is it testing 10? Is it testing 100? It's kind of open-ended. So, you know, that's one that the department is going to have to kind of clarify a little bit, is what is statistically significant, because that's how they're gonna, you know, it's random sampling, and that's what they want. They don't want people cherry picking.
Yeah, and it's also, you know, from a processor, it's so expensive to get your samples third-party tested. I just went through this process. My my crude has to get tested. My specific bottles have to get tested. Like each SKU, each product has to get tested, and those tests are in the hundreds of dollars. So if you have to, if each lot of each test, so I mean, this isn't breaking. It does say per significant number of hemp products per lot or batch. So it's, to me, that reads that every single SKU that you're getting produced has to get a significant number of tests. And let's just say I'm a small business and I'm only doing 200, 1,500 milligram tinctures. Well, what's statistically substantial there? Is it 2 of those have to get tested? And is each one of those a $200 or $300 sample? Or testing, you know, and is the, it's not going to fall on the processor's hand in many cases. So looking at like kind of chain of custody or chain of payment is something really important to consider, and especially budgeting for your business. All right, so 8, maintain sufficient records pertaining to the calibration and inspection of instruments used in extraction manufacturing of cannabinoid hemp products. So just general diligence. And this is all, like, a lot of this stuff, like the records are important so you can know, you know, and most businesses will want these innately because you can track your efficiencies, you can track your productivity, the quality, how you're actually operating as a business. So 9, report in a frequency and manner prescribed by the department the total production and sales of the licensee during such reporting period. 10, ensure the security of the licensed premises to prevent unauthorized individuals from entering the facility and to prevent hemp extract or cannabinoid hemp product from being diverted from the facility. Obviously, leakage is a big issue in general. I'm sure we're going to see that come up again. 11, not use synthetic cannabinoids in the extraction or manufacturing of any cannabinoid hemp products.
Last time I think is important.
Yeah.
Because we got in last time to the definitions, and they refer back to the public health law, and, you know, you could get into, and I don't know that there's any definitive answer, you know, whether Delta 8 is synthetic or not, or, you know, probably have to talk to the department or a chemist or something. But, you know, it's something that they're going to have to clarify of what you know, what certain chemical formulations are or not. And it's important because, you know, they're straight out banning.
Yeah. Yeah. And I think that, you know, as we talked about, Delta 8's a big hot topic right now. And as Kaylin defined or interpreted the rules and regs of Department of Health and what what do we call it? The synthetic definition of, like, Delta 8 is being converted from CBD for in some cases with the use of a synthate or, you know, some kind of enzyme that then converts it into Delta 8, which is technically using hemp-derived product, cannabinoids, to make it, so it's not synthetic. But, you know, I think it's definitely begs the question, where's that line? And it would be valuable in general for more clarity. So those operating in the world of, let's say, Delta 8 or these kind of combination or kind of more laboratory enhanced cannabinoids are operating safely, clearly, and within a known jurisdiction versus kind of playing around, fingers crossed, when the law could just come down and smash you. So there's definitely a lot of concern of too much oversight, but it's also, if there's not enough oversight or clarity, I think that could also be detrimental to people who are playing in the gray zone if it comes down.
Zach, if I could add something on, because I spent a lot of time trying to uncover exactly what how they want to regulate Delta 8. And so they say that any THC, any hemp extract THC that has under 3.3% Delta 9 is legal and considered a cannabinoid hemp product. And that includes Delta 8 THC. They notably exclude synthetically derived tetrahydrocannabinols from that definition, and they refer to the public health law. And in the public health law, they give a list of specific compounds which fall under that definition, and Delta 8 is not in there. So while they don't explicitly say anywhere that Delta 8 is a legal cannabinoid hemp product, from at least my interpretation in the work we've been doing, it looks like that, there's nothing in the regs that are actually preventing it from being used as such.
Great. There was a question that says, I thought the acid pushed CBD to Delta 9, then to Delta 8. Heard passing Delta 9 is a legal issue. Great question. I honestly don't know enough about the chemistry, but I've heard a couple different methodologies and explanations. So I think it's something to look further into. And I think that's a great question, Tom. All right. So to continue, we will, so number 12, assign a lot or batch number to each of the hemp extract or cannabinoid hemp products extracted or manufactured by the licensee. That's pretty standard. 13 says maintain any and all records required by this part for at least 5 years and immediately produce such records upon request of the department. So this is no matter where you are. If this is just a highlight, bold, underline, make sure you got your stuff in alignment. Make sure you are ready to be able to prove your history and the integrity of your chain of custody and or procedures on site.
Yeah, because as it shows later, they can come on anytime they want during business hours and do inspections and make you pull records and things like that. So it's important to basically, have those archived on a server or something where you can just pull them right up and you're not sitting there going through boxes and stuff like that, because they'll make you do that.
Yep. All right, so B, possession and the intermediate sale of hemp extract by and between licensed cannabinoid hemp processors is permitted, provided when such extract leaves the licensed premises, it is accompanied by a certificate of analysis certifying that the extractant has less than 3% THC and a copy of the cannabinoid hemp processor's license, and further provide such hemp extract is only transported intrastate. That's a big one.
Within
the state, which gives a lot of leeway, because there's a lot of concern about creating this full spectrum extract products, and then it can't leave the door because its Delta 9 is too high. Because if you have something with 0.3, if you have something with 3% THC, like that's obviously a significant number higher.
10 times the legal amount.
10 times the legal amount. And so this gives a lot of liberty within intrastate actors. And as we know that a manufacturer, an extractor can sell to a manufacturer. So this could go to a small business that is just infusing products. You could go to another extractor that is refining further. But I think that was I know the team from the NYC GPA has expressed some excitement around that number, because it gives leeway for state businesses to operate, again, in this New York State kind of confined or protected jurisdiction. All right, just make sure I did the right thing there. Okay, so C, licensees shall monitor complaints from cannabinoid hemp retailers and consumers and have a mechanism in place to notify the licensee supply chain to recall products when directed by the department or is deemed appropriate by the licensee. Licensees shall notify the department within 24 hours of learning of a serious adverse effect. So this is just something we mentioned last time. It's like you got to have your ducks in a row to be able to, one, hear from your supply chain, and then two, be able to contact the Department of Health with a clear expression of what's been discovered. And I'm sure there's going to be more protocol or description as to like what and how we report, but just something to really be aware of. So D, the licensees shall ensure the proper disposal beyond reclamation of any hemp extract or byproduct from the extraction and manufacture process with a total of delta-9 THC concentration greater than 0.3%, of which will not be used or subject to further processing. Such disposal shall render the hemp extract or byproduct unusable for intoxicating purposes. Licensee shall maintain records to document and track any delta-9 THC extracted from hemp or found within hemp extract throughout the extraction manufacturing process, including records pertaining to the amount used in cannabinoid hemp products and the disposal of all hemp extract.
I also think that one's pretty interesting too, because under the USDA regs, granted it's dealing with the plants, you have to dispose of any hot crops through like a a DEA certified disposal facility that's, can dispose of drugs. And New York isn't requiring that. So again, you have this federal and state conflict where technically the feds can come in and say, well, that's not compliant with what we want.
Mm-hmm.
So, just another issue where people are caught in the gray area. Well, we're in compliance with state law, but we're not in compliance with federal law, so we're going to try to have to do the best that we can, but it's always up in the air as to what could actually happen.
Yep. So to continue, licensees, so one of that section D is licensees shall dispose of any cannabinoid hemp product that is outdated, damaged, deteriorated, contaminated, or otherwise deemed not appropriate for sale. And licensee shall dispose of liquid, chemical, and hazardous waste in accordance with applicable federal, state, and local laws and regulations. So that's going to be fascinating to see. There's a big issue on the West Coast where, specifically in California, where cannabis waste is considered like a medical waste in many cases, or like a hazardous waste, and has to be shipped to like hazardous waste facilities versus just going to a landfill or getting composted. Like there's actually a higher requirement for how to get rid of the waste in other states, especially if we're talking about THC. We're talking about marijuana product by the definition of federal law and state law too. So it's going to be very interesting to see what it looks like, what accordance looks like for our state. So E, the department may conduct random sampling and testing of hemp extract, cannabinoid hemp products, or any solvents, chemicals, or materials used by the licensee unannounced at any time during normal business hours of the licensee. Then F, if a cannabinoid hemp processor is authorized to perform extraction, the processor shall, 1, only extract using methods approved by the department on the licensed premises and using employees and equipment sufficient to ensure safe extraction. 2, use only those solvents that are approved by the department. Solvent-based extraction must be completed in a commercial, professional-grade, closed-loop system capable of recovering solvent used for extraction.
I think that's important to know too, that like, that means that if some new method comes out that's awesome or whatever, you can't necessarily use it until the department stamps approval. It could be used in every other state that, is doing it. And until the department says, yes, you're good to go, you can't use it. Maybe it's a cheaper, better method. Can't use it.
Yep, that's important. Jason, would you be willing to take the next section?
Sure. All right, so cannabinoid hemp product requirements. All cannabinoid hemp product distributed or offered for retail sale in New York shall be manufactured in accordance with Part 101, 111, and 117 of Title 21 of the Federal Code of Regulations. So 101 is food labeling, 111 is GMP, good manufacturing processes for supplements, and 117 is GMP for human food. So you got to figure out you got to figure out which ones you're going to have to be in. And that actually comes in, one of the things a little later on that we'll discuss is the amount of milligrams of cannabinoids per product. So, that all kind of affects which group you're going to be in and what you can sell ultimately. All right. 2. Contain no more than 0.3% of delta-9 THC concentration. The department shall have the ability to impose a total delta-9 cap in milligrams per serving and milligrams per package for cannabinoid hemp products based on the product form, volume, number of servings, and ratio of CBD to THC. Important, Zach and I were discussing this at one point because before I had read through the full thing, I was like, well, so if you had, let's say, 1 milligram of product that contained 0.3 or less than 1 milligram, very, very small, contained more than 0.3% THC, and there's 1,000, servings in a bottle, does that bottle is that just like buying, regular cannabis that'll get you high because you can just slam it all back? So the department is saying, we see what people can do here, and we're going to regulate how much as a percentage of the product can be THC, not just the serving, because you could definitely have a product that is, a huge amount of servings, but not a huge amount of product, and you could ingest it and get high. So they're specifically saying we're going to regulate this. We don't exactly know how yet, but that they have the ability.
Yeah, I think it's really important. I've seen some things on the shelf that say there's 10 gummies in a pack. There's 30 mgs of THC delta 9, and there's let's just say 100 mgs of CBD, but each gummy, the ratio is only 0.3% of the total gummy is delta 9, but it translated to 3 milligrams of THC. And personally, if I was to go to a recreational market and eat 3 milligrams of THC, that's basically all I need. Maybe it could do a little bit more, but that's pushing the high zone. And I think that's just, again, underlying the importance to consider the total content of a product and per serving. And when we break down the numbers, it's it can easily have more milligrams per serving than it can look closely to recreational pretty quickly, which is fascinating.
Yeah, you can go down to a medical dispensary right now and get 5 milligrams per serving of THC. So there's product on the shelves with 3. So take 2 of them and you're already over the minimum dose for the medical. So that's why that is in there, so that they can regulate that, because it is a potential giant loophole.
Yep.
Okay. All right. 3. Your products can't contain basically any alcoholic beverage. So no mixing CBD or any cannabinoids with alcohol. And that is a definite precursor or, foreshadowing to recreational cannabis. They're not going to have alcohol plus THC beverages. Also, you're not going to be allowed to sell both products, beer and cannabis, in a store. Same with tobacco. So no mixing, obviously pre-rolls, they explicitly said were prohibited, but you couldn't have a pre-roll that's tobacco and flour or something like that. Kaylin and I kind of discussed this last time, but no injectable, transdermal, inhaler, suppository, or flower products. And there again is your flower ban out in the open is, no interpretation needed. Anything with flower is prohibited, as well as things that, are kind of medical devices.
And we did go back through last time and looked at transdermal patch, inhaler, suppository. These are all things that are regulated by the FDA, need FDA approval. And that's this unique place where we're looking back at a federal definition, even though New York State is in other places determining statewide definitions. And I'd be curious to see if this is a blueprint for recreational, how we'll begin to look at this, because in rec markets, there are all of these things. And I think that's important to consider.
Yeah, I find it funny from a legal perspective that New York State literally is just picking and choosing which federal laws that apply for seemingly no reason. We're going to listen to the FDA on this, but not this, when the FDA has said, no, this is important too, and we're going to regulate this. So it's very weird. I don't know.
Well, we got a question from Corey. Any idea if these regulations will allow a person to hold both a liquor license and a hemp-based license through different entities?
I haven't seen anything that prohibits that. it's mostly just based on you can't have them in the same premises. So I don't think, though I don't know for certain, that there's any prohibition that, oh, I own a bar that's on one side of town, and I own, I process CBD on another side of town, and it's a totally different business, and they're not related in any way. They don't cross sell each other's products. I've not seen any prohibition on that. Yeah. Does the flower ban, we got another one. Does the flower ban include tea blends with hemp flower as it's being brewed and consumed as a beverage?
I mean, so as we're reading the rules, and this is where I think there's a massive misinformation campaign around calling all flour smokable flour and not providing any other forms of consumption or direct sales. And I think this is where the state is really, I think, shooting the farming community in the foot. And I think that, so I will say yes, because we cannot sell any form of flour product. And even if the flour product is mixed in with a tea blend and is a fraction of that total tea blend, I would go so far as to say, if I can't sell any of the listed, whether flour products, including but not limited to the cigar pre-roll, or just raw flour, shake, trim, whatever, you name it. It does feel like it's a no if we're going to say flour product in general.
Yeah. I mean, go back to the definition of flower product. Any hemp flower product, flower, buds, leaves, trim, stem, intended for retail sale without further processing.
Yeah.
So I don't know that, I don't know that would qualify your question as further processing. Now, maybe they loosen it up a little bit, like in the medical market, they now sell the ground up flour, even though you're not technically supposed to smoke it. Because their clear concern here is that people, like, if you had that type of thing, would extract the flour from it and smoke it or something like that. That's clearly what they're trying to get at, whether that's realistic or not, not the issue. So, they might start to say, okay, if you're mixing it into things that would be hard to, like, are you going to sit there and say, okay, this is a tea leaf, this is a flower, like that would be ridiculous. Maybe that's okay. But under a very strict and conservative reading of the regulations, which is the only thing I would advocate right now as a lawyer, would be no, it's not allowed.
Yeah, and that's a great point to make too, I'd say, from a commenting perspective. It's tea blends are, I will go so far as to say, least likely to be harmful, let's just say, something of that nature. It's like, it's a very simple thing. It's there's ways to ensure that the product is clean if it's sourced and has a full panel test, et cetera. So, why criminalize making a tea blend? It feels very simple and kind of silly to me. So great question, Caitlin. We got a couple more in the pipeline. Can you sell flour to processor in another state? This does not change. This bill does not say anything about, it's not about the farming community here. But the farming community is screwed by the regulations. Just in my personal opinion, I won't say that. That's not. Let's just leave it at that. So there's nothing saying that the 2018 Farm Bill allows for interstate sales. However, we have to look again at total THC of any part of any plant, and that means if they pull out a bud of your biomass and it's got above 0.3% THC total, then you're in trouble. If they pull out a stem and it has that same number, it's like, if we look at the federal description and definition, any part of any piece of any plant, like there's a lot of room to be like operating in a federally illegal manner when we're talking about product, unless it's really emulsified. So just, when we say flour, like, yeah, what's the chance that if your flour crosses the state line, it's going to be compliant with federal regulations? So I think that's an important note to have there. And then I am here more on the recreation retail side. We have met with a group from Oklahoma that's combining businesses at the same site to reduce tax load. So coffee shop, 80% of the space, THC, 20% of the space. Therefore, 280E applies only to the 20%. Any thoughts? I think that's an interesting thing. One, I will say Oklahoma is the Wild West. Like, literally, y'all go Google what's going on in Oklahoma right now. Like, you would be surprised to see what the medical what's going on there. So I think you have really interesting insight into a unique playground of the cannabis industry. Like literally the Wild West has kind of moved slightly eastward, inland. And that's a good question. Jason, you got any thoughts about the 280E thing?
So there's kind of two questions there. I think one is the 280E question in terms of taxes, and one is how it applies to what we were talking about of, I sell alcohol over here and CBD over here. So with the tax question, it's a federal tax issue, so it has really no bearing on New York. I can tell you that the IRS is going to scrutinize the hell out of that. If you say, 80% is totally, outside of 280E, you can prove it, but you're going to have to prove it. And if you do a substantial understatement, you're in for I forget the penalty amount, like 20% or something like that, plus interest, and it's a hassle. And their auditors on 280E are particularly rapid. For if you were to kind of take that idea and apply it to, 80% of my store is coffee and 20% is CBD or not coffee, let's say alcohol. No, that's not going to work. New York draws a pretty hard line that you can't share the premises with any of that stuff. So if you read the proposed MRTA or CRTA legalization bills, they make it very clear it is the premises. You would need you need walls, you need separate entrances, any kind of pass through has to be a secure door. So there's really no way to get around I have my bar here, I have my dispensary here, and people are, can freely go back and forth.
And that's where, again, I think Oklahoma has a very unique structure right now where there's a lot happening that's not happening in more of the advanced states. It kind of feels like early California or early Colorado, where, again, I'd recommend folks go look into that. So, Patrick, happy to look at that more downstream. I don't think we're probably going to keep moving forward on this specific subject, but I think it's a great question, and you're in a really unique opportunity that will probably provide some insight. Also, if you have any insight, feel free to email us as a follow-up, because we're always talking about this kind of stuff, and we can have another workshop that focuses on kind of 280E and tax structures, et cetera. So thank you so much.
We had another question in the chat.
Yep. So Ram, I see you said, are there any incentives for organic farming where no chemicals or pesticides are used or waste materials recycled on site into soil conditioners? That's a great question, Ram. I think it's a higher level future thinking where right now the Ag and USDA just released the initial pesticides and fertilizers that can be used for hemp. In the pre-2018 Farm Bill, you couldn't use anything on your hemp product, technically. And now they're beginning to release some applicable products. And there is definitely no incentivizing at this point in time. Besides, if your product comes back dirty, it will get rejected. There's a specific parameters for parts per million at the end of this document with regards to pesticides, et cetera. So that will really determine how or what can go to market. But I do think that it's important to consider these kind of higher level of recycling and on-site production like you're talking about, but it's not so defined yet. So good question, and we'll continue to look at that. Yeah, and Richard just added a comment with regards to Oklahoma only has medical marijuana too, but they have low barriers of entry and make obtaining prescriptions super easy. So there's flower, everything's available, and that's what's really allowing this market to boom right now, which is it's basically laissez-faire. It's an open market, which is probably the opposite of what we're talking about in New York State. So I think that's a great comment. Thank you, Richard.
All right. Where did we leave off? I think we're on 6.
Yep.
Accurately reflect testing results and contain not less than 90% or more than 110% of the concentration total cannabinoid content as listed on the product label. So you get a 10% variance.
Yep. I am seeing some of the national organizations that commented on New York State's proposal are saying 80 to 120%. So increasing the margin of error, which is interesting.
Yeah, because it could be a potentially problematic provision. It's not, it's not too much of a concern for your CBD tools, but when you have to list your minor cannabinoids on the label and you have to have them printed, and they're in such small quantities that this small 10% margin of error it could very possibly test outside of that just naturally, just from the nature of, batch to batch. So that's something I know that was brought up in a lot of comments that have been submitted so far. And I know that's been a major concern for a lot of processors, because the labeling requirements require you to list a lot of those minor cannabinoids on the label itself. It could cause some non-compliant products.
Yeah, and I think that begs the question too. If you have a 2,400 milligram tincture or a 3,000 milligram tincture, which would be the limit, like for CBD, if you have 2,400 milligrams of CBD, high probability that you're going to have another cup, like 100 plus milligrams of another cannabinoid, or a blend of the minor cannabinoid. So that's a great comment.
All right. Comply with the packaging and labeling standards, which we'll get to next. Be prepackaged and not added to food or any other consumable product at the point of sale. This was something because people were, I don't know if they were doing this, probably were, but certainly suggesting it when, when CBD was first coming on scene in New York, flat out said no food and beverages with CBD. People were saying, well, can I sell a brownie with a thing of CBD and people can add it together? That makes that a no-go. So very explicitly, at least they're thinking about the loopholes that people used. Whether you agree with them or not, they did look at what was being done and said, okay, we want to regulate this and we're addressing it. So, if anything else, they were thorough. Has to be shelf stable, has to comply with the product testing standards that we will discuss later.
One thing I want to mention real quick is they don't actually define shelf stable. So we took a look in the Code of Federal Regulations for what that means. And part of that means that the product cannot be refrigerated, or that could be a potential issue. And I know this is another thing that's been brought up in the comment period, is that what if you're making CBD beverages? If you were to make a CBD seltzer, for instance, and you want to sell that at a store, but for it to be shelf stable, you can't leave it in the refrigerator at the store. So you would have to buy it off the shelf, and someone couldn't just walk into the corner store, grab one from the fridge, and walk out. So
No, that is important.
All right. If the cannabinoid hemp product is a food or beverage manufactured under Part 117, it shall not contain more than 25 milligrams of total cannabinoids per product. Important again, because unless you're doing a CBD isolate or something like that, it's going to be CBD plus every other cannabinoid in it. And that's per product, not per serving. If the cannabinoid hemp product is a supplement manufactured under Part 111, it can contain no more than 3,000 milligrams of total cannabinoid products. Again, total cannabinoid. So just important to pay attention to those little things because, Zach was just saying, it's going to have those milligrams of other cannabinoids, and those count. Let's see. If the cannabinoid hemp product contains multiple servings, which are not individually wrapped, it shall include a measuring device such as a measuring cap, cup, or dropper with a product package. Hash marks on the package shall not qualify as a measuring device. All inhalable cannabinoid hemp products shall meet the following additional requirements. It's a closed system with pre-filled disposable cartridges and attaches to a rechargeable battery or single-use product that cannot be recharged. So kind of addressing the whole ground flower in the medical market thing. And electronic vaporization devices shall have internal or external temperature controls to prevent combustion and have a heating element made of glass, ceramic, or stainless steel, not plastic or rubber. Except for hemp-derived terpenes, excipients, and ingredients must be pharmaceutical grade unless otherwise approved by the department, and shall not include a whole host of things, but some common ones would be synthetic cannabinoids, polyethylene glycol, vitamin E acetate, that was literally killing people, MCT oil, which is a pretty common one in some markets, so that's one to note. Medicinal compounds, so don't be mixing your CBD with aspirin. Illegal or controlled substances, ironically, THC is a controlled substance, but regardless, not that one, unless it's over 0.3. Artificial food coloring, and no flavoring except for terpenes. And that kind of makes sense with the whole flavor ban in the vape market. So, terpenes do have flavor, limonene, lemon, that kind of thing, citrusy. So those are okay, but no, like, you're not going to have like Hawaiian punch flavored. Let's see. And
oh, it's interesting that last one, number 5, it says starting on June 1st, 2021, include a department approved symbol in a manner that is clear and conspicuous. So like my question would be, when are they going to come up with that symbol? When are they gonna make it available? Because like right now is the time to begin purchasing your inventory. Like if I'm gonna be launching my vape product, I'm gonna need all my stickers, labels, boxes like made immediately. Like the time is now for people to be prepping their products for downstream. So it's kind of setting up for some potential trouble. And I'm curious, like starting June 1st, I wonder if there will be a leeway or some kind of like window for people to get rid of existing product. Like if you have, 1,000 vape carts that you purchase tomorrow or on January 2nd, and you still have 200 left on June 1st, will they allow you to continue to sell on the existing packaging, or will you have to purchase more? Or maybe if it's a bigger number, maybe it's in the thousands, where again, you have to, every single label you purchase, every single box you purchase, like those all have high overhead. And if not done tactically, it could really hurt a small business. All right, so section 1005.9, packaging and labeling of cannabinoid hemp products. Joe, you want to take a swing, or what's your thoughts?
Sure.
Sweet. Great. All right, so got you going.
Yeah, all cannabinoid hemp products distributed or offered for retail sale in New York State shall include the following information on the product label and packaging. 1, a nutritional or supplement fact panel that must be based on a number of servings within the container and include a list of all ingredients in descending order of predominance by weight in the product, including but not limited to the total delta-9 THC concentration, CBD, and any other cannabinoids over 0.05%. So that means that even any minor cannabinoids must be listed as part of that fact panel. And that's where, going back earlier with the margin of the 90 to 110%, that could be potentially problematic if you have to list cannabinoids that are in such low quantities as 0.05%.
And it begs the question too, if you're thinking about packaging, like, do I need to list, what if you get a COA that changes by a slight factor? Like I'm extracting my lifter and I have all my tinctures made with lifter, but that like the 5th batch I got extracted had a slightly different, narrative to it, different COA. So we had different cannabinoids organized. And it's like, do I then have to like throw out my boxes? Can I have it? Can it be a sticker? Does it have to be on the label of the product itself, or can it be on the box itself? Those are all questions that I think are important. Like when we talk about batch, lot, et cetera, there is variation within these testing. Even in, as I understand it, when your COA, like when you get a product tested third party, the machine is calibrated for specific parameters and ran, and you'll never get that specific calibration again. So the next time you could run that same product and the numbers could be slightly different just because of the way, the input for the testing material is required, the way the machines operate, the way the liquids within the machines change. And so it's like, it's better to get all your samples tested at once because it's all the same testing parameters, versus if you delay the testing date, it's kind of a new condition to be testing under. So I could see that being a major issue.
Yeah.
We do have a question here, Michelle. So no more flavored tinctures or vapable CBD? If so, when does this go into effect? I think the flavor, everything we just talked about was pertaining to vapable products. So inhalable. And the only thing that's allowed to be inhaled is a vape. So it's not going to be, you're not going to be able to add blueberry punch to your vape pen. I don't see anything that says you can't have a different flavor of your tincture, your CBD tincture. So that's a great question. And that formally will go into effect, it sounds like by, this goes back to the retailer requirements. To be a retailer, you have to basically be registered as a retailer by April, or that's when they expect you to be registered by. So if you're selling any of these products, let's say by April, you want to be compliant with And then the next step was by June 1st, there will be a symbol that you have to have on all your products to prove that it's approved by New York State. So hopefully that answers your question, Michelle. All right, cool. So we're on to that two there.
Yeah, and then also the fact panel must include the number of servings per package or container, including the amount of measurable cannabinoids in milligrams per serving and the total cannabinoid content of the package. And if applicable, the amount of total delta-9 THC in milligrams per serving and milligrams per package shall be stated on the label. You also need to put the expiration date, a lot or batch number, the name of the cannabinoid hemp processor or out-of-state manufacturer, and a scannable barcode or QR code which links to a downloadable certificate of analysis.
Now, there has been some feedback about questioning the COA or the QR code. And I'm curious if anyone has any questions regarding that, but it is people kind of expressing concern around ability for a small business or an in-house farm team to be able to utilize that technology. So there's a concern about lag in technology, where in some cases it's been very well adapted, in other places, it's still a foreign language. So I don't know if that will change, but I do know it's something that's been brought up.
Six, the states of origin from which hemp used in the product was sourced, or if sourced from outside the United States country. 7, a means for reporting serious adverse events or side effects. And 8, any other marketing statement or symbol as required by the department. Going on, no cannabinoid hemp product shall be packaged or contained in such a manner so as to be attractive to anyone under 18 years of age, or for inhalable cannabinoid hemp products to anyone under 21 years of age. All cannabinoid hemp products shall be packaged in tamper-evident packaging that minimizes oxygen and light exposure. They shall be accompanied by recommended dosing and clear usage instructions. And all cannabinoid products claiming to be isolate, full spectrum, broad spectrum, or distillate shall comply with the applicable definition contained in this part. And F, all cannabinoid hemp products offered for retail sale shall include the following warnings on the product label or packaging in a manner that is clear and conspicuous, and be written in text no smaller than size 8-point font, which is another problematic thing that a lot of people are looking to get changed. Is if you have a small little tincture bottle and they want all these 4 or 5 warning labels spelled out on the label itself in 8-point font, it ruins your label real estate, because then you just don't have enough room to also put a fact panel on, also list all the cannabinoids, list where the hemp was sourced from, list who manufactured it. So we're gonna,
not to mention your logo,
Yeah, your logo. Yeah, you can't even fit it on there after a certain point.
Yeah. I do just, Ram, real quick. I'm not aware of any specific permits required for locating CBD facility from a retail perspective. I haven't seen any parameters or prohibitions like locally or regionally. I do think that we will see for manufacturing, it will be like, I don't know if it's industrial and commercial, et cetera. And for the grower facility, I think there's probably going to be some parameters around indoor growing, but a lot when it comes to farms, there's no regulatory requirements or limitations that can be implemented, as I'm aware. But I think it does beg the question, like, does right to farm hold up for indoor grows? Does right to farm, if someone has an agricultural lot in the town of Canandaigua, let's just say, which is just, maybe it was grandfathered in because of the way the deeds were transferred. Can someone grow a big hemp grow in the middle of a town, or could it be banned? Those are all important questions that I personally have not seen anything along those lines yet. But we can definitely keep you updated as we learn.
All right, and then, just to round this out, so the following warning labels must be included. 1, keep out of reach of children. Warning stating that the product is derived from hemp and may contain THC, which could result in the consumer failing a drug test for marijuana. That the product has not been evaluated by the FDA for safety or efficacy. And for those who are pregnant or nursing, to consult their healthcare provider before use. And if the product is an inhalable product, warning stating that smoking or vaporizing is hazardous to your health.
Oops, sorry about that. Okay, great. Yeah, so definitely, if anyone has ever gone through the branding, marketing, labeling, packaging development process, I can tell you that it is a headache in itself. And then we begin to look at this fine print that is, it adds a lot of consideration. So a company, a business, a small business that is not well versed in design or packaging, how do you do all this first and foremost? And then how do you do it in a way that is still aesthetically pleasing and can engage with your target audience, et cetera? And I think it's just like the value of hiring a lawyer, the necessity of hiring a lawyer, you begin to see the necessity and value of onboarding or working with organizations that know how to navigate this design parameters, because it's truly complicated.
And I know that from what we've heard with the Department of Health in the comment period, is that one of the major areas that they're looking to review in the regs, and one of the major areas I see a lot of comments on, are the labeling requirements themselves. So it is possible that over the next couple of months, we start seeing some changes or amendments from the department, which may make them a little less stringent, but you can't say for certain yet.
Yep, true. Okay, great. So laboratory testing requirements for cannabinoid hemp. For the purpose of this section, the following terms shall have the following meanings. Accreditation body means an impartial nonprofit organization that operates in conformance with the International Organization of Standardization, ISO, or International Electro. I'm not even sure how to pronounce that word. Anyone have that second? The electrotechnical. Sorry, my eyes are confusing me there. So the International Electrotechnical Commission, the IEC, standard 17011, and is a signatory to the International Laboratory Accreditation Cooperation, ILAC, Mutual Recognition Arrangement, MRA, for testing. So a lot of big words in there, and a lot of organizations that have really, really high standards. And so I think that's when we go to like third-party testing or analysis of your GMP certification, of your ISO certification for the testing laboratories. So there's a lot of laboratories in New York State that have the capacity to test for cannabinoids, but they have to meet these standards that are quite high. And it's kind of differentiator between someone who has it creates a lot higher overhead and kind of enhances the requirements for what a company needs to be able to participate in the testing of cannabinoid products. 2, a certificate of accreditation means a document issued by an accreditation body that tests to the laboratory competence to carry out specific testing and analysis. 3, the testing laboratory means an independent third-party laboratory contracted by a cannabinoid hemp processor to test cannabinoid hemp products. So B, to be recognized as a testing laboratory for the purpose of testing cannabinoid hemp products as required by this part, a laboratory must either be approved to test medical marijuana pursuant to section 55-2.15 of this title, or meet all the following minimum requirements. Maintain an ISO IEC 17025 accreditation for the premises and for the testing of 1, cannabinoids, 2, heavy metals, 3, microbial impurities, 4, mycotoxins, 5, residual pesticides, 6, residual solvents and processing chemicals, and 7, if tested, terpenoids. So 2 is maintain a valid certificate of accreditation issued by an accreditation body that tests to the laboratory competence to perform the testing and analytes tested in subdivision B1 of this section. 3, maintain method validation reports for all testing performed. 4, maintain standard operating procedures for the sampling of cannabinoid hemp products. It's interesting that they don't offer a what they call an assay, a standard methodology for testing, and that's a massive issue across the board in the cannabis industry, that there are currently no standardized testing procedures for cannabinoid content. Now, there will be for pesticides, there will be for heavy metals. Those are all standardized things in general, but when you begin to overlay cannabis and hemp, it's a big issue within the laboratory community and a lot of conflict and confusion there. Maintaining, okay, so C, cannabinoid hemp processor shall retain and make available to the department upon request all records associated with their testing laboratories ISO IEC 17025 accreditation, certificate of accreditation, method validation reports, and standard operating procedures for the sampling of cannabinoid hemp products as required by the section. D, cannabinoid hemp products shall be considered adulterated and shall not be sold in New York State if contaminants are detected at levels greater than provided for by the department in this part or issued in further guidance. And E, the department shall have the ability to impose additional testing requirements, including but not limited to testing for additional analytes, setting stricter contaminant limits, and mandating the use of specific sampling methodologies per lot or batch manufactured. So that's kind of alluding to the future assays we were talking about. Pesticide limits. This kind of goes back to Ram's question. Pesticide limits. The following list of contaminants does not constitute authorization to use or apply any of the following. That's important. But it does still outline what what's allowed downstream in products. So I think it's fascinating you look at this list, 300 parts per billion, 3,000 parts per billion, 100 parts per billion. You begin to look at some of these things like, we could talk all day about what pesticides are out there and what are in those products. But when we begin to look at things with 100 parts per billion, you got to know that's pretty intense stuff, and you don't want much of it in whatever you're trying. So this is a long list. We will avoid that, but here's the residual. Did we pass over anything else there? So these are the contaminants, pesticide limits. Then there's residual solvent limits. So we begin now look at that. So parts per billion is the pesticides, and then there's parts per millions for residual solvents for the most part. Again, you can look at butane, you can look at ethanol, hexane, isopropyl, pentane, propane. These are all things that, there's a variety. This doesn't mean that they're allowed to be used, but this is what the limits are within the production process. And metal limits, why can there be 0.5 micrograms per gram of lead and only 3.0 micrograms per gram of mercury? I don't know that answer, but it's interesting to begin looking at those numbers. The biological limits, so staph, E. coli, salmonella, and then some of the mycotoxins. So section K is cannabinoid limits. So total delta 9 THC concentration for hemp products shall not exceed 0.3%. If cannabinoid hemp product fails, the processor may elect to re-extract the failing batch to reduce the total of delta 9 THC of the batch to not more than 0.3%. If the re-extraction batch still exceeds 0.3%, the product shall be destroyed. I think that's important. So there's opportunity to resolve the issue. That being said, if the second resolve does not suffice, then the product has to be destroyed. We've got a couple questions coming in. Were these adopted from, I don't know, anyone? Drinking water standards. Okay. I don't know. That's a great question. Well, I think it's worth looking into. Were these adopted from drinking water standards by the DOH, particularly with regards to heavy metals? I think that's a great question. I don't know. We can definitely look into that. Those are the most stringent. So what's page 42? So we are going to continue on to the hemp retailers. Jason, you want to take a swing at this? And I think this is our last section for the day, if I'm not mistaken.
Oh, we got to do the next one as
Oh,
well.
we got one more after that.
All right, requirements for hemp retailers. So they shall only sell cannabinoid hemp products manufactured, packaged, labeled, and tested in accordance with this part. So meeting New York standards. You can't just take something that meets California standards and sell it in New York. So important to understand that. Cannabinoid hemp retailers shall not offer or sell inhalable cannabinoid hemp products to anyone under 21 years of age. Retailers shall have sufficient safeguards in place to verify the individual presenting or submitting proof of age for inhalable cannabinoid hemp product. Matches the identification as 21 years of age or older. So, think alcohol.
That's an interesting one too for like, how do you do that for online sales? Like, I was recently looking at a gift for a friend, went onto the PAX website, which is a vaporizer. And I went to purchase that product and I made the purchase and then they messaged me saying they have to validate my age. I had to submit my license, wasn't enough. I had to submit my passport. It's like I had to submit so much documentation to prove that I was 21 to purchase this piece of equipment, let alone the product. So if we begin to look at selling online, what are the requirements, one, and how do you keep that private information safe? And I think that's really important to consider.
Let's see. Cannabinoid hemp retailers shall post visible to consumers any and all signs or posted placards required by the department, including posting of cannabinoid hemp retail license issued by the department in conspicuous locations on the premises for each retail location. The department may require cannabinoid hemp products to be kept separate from other products on display and out of reach of children. Cannabinoid hemp retailers shall maintain sufficient records of where cannabinoid hemp products were purchased, including the name of the cannabinoid hemp processor and the wholesaler or permitted distributor, if applicable. Where cannabinoid hemp products are purchased from an out-of-state manufacturer, the cannabinoid hemp retailer shall also maintain the name, address, certificate of analysis, and evidence that the cannabinoid hemp products meet all of the requirements of this part. Record keeping, it's important. The department may inspect any retail location offering cannabinoid hemp products. This inspection may include taking samples of cannabinoid hemp products to ensure compliance with all the requirements. So they can just come in and start testing or taking stuff for testing.
And again, I wonder about online sales. How are they going to regulate? Do they go to the warehouse? What if it's drop shipping? Like all those questions come up. And I actually want to just add that like each like conspicuous location on the premises, each retail location. So every website that's selling into New York have to say that it's been certified, have its license posted on its website. Does this have to be a California company if it's selling into New York? It's like, it gets to be that's not clear to me yet.
There's some constitutional stuff there and state law. And I think part of it, if I remember right, sort of comes down to, are you just kind of on the internet for people to stumble across? Or are you specifically marketing into New York? If the former, then you just have to abide by your state's laws. If the latter, you got to abide by whatever state you're marketing towards. And if you're physically present, even if you're a California company, you have physical presence in New York, you're going to have to comply regardless.
That's important to know for sure. Okay, so yeah, last section is advertising requirements. Joe, you want to run through this?
Yeah.
Oh, we got a few. Cool.
An advertisement for a cannabinoid hemp product, processor or retailer shall not make any false or misleading claims or statements, contain claims that hemp or a cannabinoid hemp product can or is intended to diagnose, cure, mitigate, treat, or prevent disease, in line with the FDA stance.
Yeah.
I just want to comment on that part too. As a lawyer, I see people doing this all the time and I yell at them. You can't say things like this may, no good, that violates FDA rules. And that's going to be covered by that. Like, you can't give the average person the perception that this might do something, because the public doesn't know the difference between may and will, based on FDA standards. So it's very important. Basically, you have to say, here's this product. That's really like the safest thing you can do. If you start to say even testimonials violate FDA rules, very, very, and that's what we've seen the FDA busting people on. They send enforcement letters, and they can actually come and confiscate your products. So very important to abide by that. And if New York State is saying it now, you can bet the enforcement's going to be stepped up a bit.
Yeah. Mm-hmm. And these last two. So an advertisement may not lead a reasonable person to believe that a cannabinoid hemp product is marijuana, medical marijuana, or that a licensee is authorized to sell or dispense marijuana or medical marijuana, as those terms are defined in Article 33 of the Public Health Law. And lastly, advertisements may not have the purpose or effect of targeting or appealing to anyone under 21 years of age for inhalable cannabinoid hemp products. The use of images of children or minors consuming the product, and the use of words, a design, or a brand that resembles a product that is commonly associated with children or minors or marketed to children or minors is prohibited. So.
Great. So that is all that we have lined up for today. We got 5 more minutes. Please let us know if you got any questions. So there's a lot there. And again, line by line helps us really see this. It's easy to read through and just say like, oh, like for me, I can read through the document, but I might not have the full context of what it means. So to have this perspective, I think has been really helpful for myself to interpret and hopefully for all y'all out there as well.
And it comes down to you don't know what you don't know. So,
Yeah.
you know, something might be important, but you don't know that it is important and therefore it's glossed over, where somebody who's familiar with it can say this is something important to pay attention to.
So we got a question from an anonymous attendee. So a no on testimonials on your retail website.
Violates FDA rules.
I think what I do understand, the no is with regards to people referring to health benefits.
Yes. So if I am up there saying, if you have a video of me on your website saying, this CBD product helped me with my insomnia, or even if I didn't use a medical term, my sleeplessness, violates FDA rules. Can't do that. Can't be, because, you know, you could say, well, that's not an advertisement. I'm not Martin. It is under FDA rules. So can't do that.
Great. And we will be sharing this to everyone who's registered. We'll send a follow-up email, so you'll be able to review this as needed. Thank you so much. Down there. Before we go any further, I do got to give a big shout out to all of our members, specifically Harris Beach, our sponsoring member. They big financial support last year that's really helped us keep the lights on. There's a ton of small groups from Boil and Code, Forefather CBD that have really been with us from the beginning. So I just want to give a big shout out to our members who've been supporting us from the beginning. If you want to support HempLab more directly through membership, we always welcome that. Feel free to message us directly. And yeah, everyone from the public who made a $10 donation, like please know you are literally helping us keep the lights on. You know, we through our Zoom costs money, long story short, and we're really happy to be able to offer this stuff to you, and just appreciate you all making the time and the contribution. We got 2 more comments. Caitlin, I saw yours coming first. Back to labeling. I'm really stressed right now with designing my labels. I'm not sure how to fit everything on a 1-ounce bottle. Do you suggest using a box in addition to the bottle? I really don't like the idea of adding extra packaging, but wondering if it's necessary. Also, I work within the topical realm. I've heard the topicals are less regulated. So that's really great questions. I will go so far as to say that the future will most likely be tinctures in boxes given their requirements. And it's amazing what the difference between a 1-inch by 3-inch by 1-inch box can do with regards to real estate, as Joe said, your marketing, branding, labeling real estate. So happy to offer some perspective more about that offline, but it's probably going to be the strongest move so you can create the brand image you want on your products and on your box. Simultaneously, the topical is different. The supplement regulation is different than the cosmetic regulation. So to my understanding, you most likely will not need a box for your topicals, but there are still some specifics that you'll need to list on there. So hopefully that gives you a little bit of relief. Welcome anyone else's perspective. We can talk more about that offline. So thank you, Caitlin. Don't stress too much. You'll figure it out. So then if these are proposed, this is from Dwayne Phillips, if these are the proposed regs and some of them could be changed over the coming months, when is enforcement realistically likely to start from a retail standpoint? Great question. We talked about this last time, that it kind of, we're interpreting the proposed regs to say that essentially a retailer can register as soon as possible to be to get their license, but they don't have to necessarily be compliant with the sales besides flower until April, let's just say 1st of 2021. And beyond that, it begs the question, like, can if a retailer is not registered by April 2021 and they're continuing to sell products, they're out of compliance with New York State. So it sounds like April is this window of when enforcement will begin. That being said, there's certain language such as on the inhalable with regards to the symbol or the stamp of approval by the state that won't be enforced till June 1st. So there are these kind of windows that aren't crystal clear, but it does sound like, and what I've also heard from the Department of Health on a call that we were able to sit on was that the first stage of engagement is going to be education. So let's get everyone licensed and then let's educate them as to what's allowed. The second window is a warning phase. And then there's maybe like the third window is like repercussion phase, but like there's gonna be a big learning curve for the state, for retailers. So it will all take time. And I'm sure from the legal perspective, Jason will say like, get your ducks in a row and be compliant as soon as possible. And I think that's the clearest thing to recommend.
Proposed means they're not enforceable. Once they are adopted, they are technically enforceable unless they have a provision that says will be enforced or is effective on. But whether they choose to enforce it, that's essentially prosecutorial discretion. And they can say, okay, these are new, as Zach said, we're going to give you some leeway. And we're just going to say, hey, you're doing this wrong, correct it.
Yeah. And Anthony has last question of the day. How should we expect CBD companies not manufacturing in New York State to follow these laws? I think that is a huge, huge, huge thing. And the question is like, we don't expect them. I like there's, some of these massive like international companies or national brands based on the West Coast, like they're not going to change all their branding, marketing, et cetera, to be compliant with New York State. Now, how long will it hold up that they're going to be kept out of state? Who knows? Is this going to be an example where New York State companies are going to do all this compliance and then within a year, the regs are going to get changed so that's going to be more lenient? And so like we spend all the money to like be compliant with New York regs and then the market opens back up again. Like that's a big concern I would have as a small business.
Realistically, the burden's going to fall on New York State retailers and things like that. Like you're the one that has to help sell compliant products. So, if a California company wants to sell products into New York through a New York retailer, you, the New York retailer, are responsible. If the California product company wants to set up a New York retail establishment, they have to get licensed and be compliant.
And last quick question, Michelle saying, when does the no flower inhaler, et cetera, start? I would say that as the language reads, retailers must be registered by April 1st of 2021. And under such registration, you are expected to be compliant. So as soon as you register between now and April, you got to be acting under accordance with the law is what we would assume and propose. And beyond that, it's, there's risk. Anything else we say beyond that, there's risk as an actor as well as recommendations. So that's just how we're interpreting it at this point in time. All right, everyone. Thank you so much for being here. We will hopefully see you all next Wednesday. Hopefully it's informing. Please give us any feedback. Hopefully the registration and payment process was simpler for everyone this time. We are slowly recovering from being dropped from our payment processor. Big thanks to Joe from the Caster Cannabis Group, and big thanks to Jason Klimek of Boil & Code. Your guys' contribution is just so huge, and really we're lucky to be able to talk about this stuff and offer it to our community at large. So thank you guys so much, and thank you for everyone for being here.
Thank you.